My name is Andrew Huff. I am the Director of Community Relations and Outreach at Sibley Memorial Hospital. And I'd like to welcome you all on this rainy Thursday afternoon to a Sibley webinar titled Caring for Mind and Body During COVID-19. And we all know that there's a lot more going on right now in our community and in our country other than COVID-19, which may make the impact and the effects of COVID even greater for many people. And you'll hear more about that from some of our panelists today. Joining me is Dr. Tilly Williams, who will be your host for the webinar today, John Kemp from A Wider Circle, Delano Hunter, Director of the Department of Parks and Recreation, and Dr. Erica Richard from Sibley Memorial Hospital. So I'd like to kick it off and pass it over to Dr. Tilly. Dr. Tilly Williams is the Executive Director of the DC Wellness Institute, where she offers a holistic approach in the development, implementation, and management of wellness programs. Dr. Tilly is a health and wellness coach, consultant, and physician with more than 35 years of healthcare service experience. Welcome, Dr. Tilly. Thank you for being with us today.
Thank you so much, Andrew. I appreciate being here too. I want to also welcome everyone to our webinar. We had originally created this webinar so we could continue our communications and support of the Washington Highlands community, where we've been working in partnership with Sibley Hospital, A Wider Circle, and DC Wellness Institute for the past 2.5 years. And, you know, during COVID-19, of course, everything stopped and everything closed. So we wanted to make sure that we had a way of communicating. So we've been doing that through conference calls and mailings and flyers and things like that, and decided that it would be good to do a face-to-face kind of communication too. But at the Washington Highlands, we work with the residents to share self-care and self-management of chronic diseases. We share that kind of information and skills and promote healthy behaviors in an active and fun environment. So the residents, we've been working with a cohort of residents that have been coming, meeting on a regular basis to talk about health and to learn about health and to do something to change their healthy behaviors. So, you know, since this was a good idea for the Highland community, we also thought it might be a good idea for others. And so with that in mind, we made this webinar available not only to Washington Highlands, but also to other community residents and partners, so who can benefit from the topics that we're going to be talking about today. So welcome everyone, and thank you for joining us. We appreciate it.
Thank you, Dr. Tilly. So we'll just go right into our first speaker. Please give me the pleasure of introducing John Kemp. John is the program manager for neighborhood partnerships at A Wider Circle, which is a community-based organization which Sibley partners with in the Washington Highlands. He's also a program manager for the outreach branch of the Washington Highlands Family First DC initiative, which you'll hear a little bit more about today. John brings over 7 years of experience in human services, homeless services, case management, and program coordination. So without further ado, John, welcome. Thank you for joining us today.
Thanks, Andrew. Thank you for that introduction, and thank you to yourself and to Sibley for inviting A Wider Circle to be a part of this. Good afternoon, everyone. As Andrew said, my name is John Kemp, and I work for A Wider Circle, specifically for our Neighborhood Partnerships program. Today, I want to tell you a very brief overview generally of what A Wider Circle does, and then get specific to the services we currently offer in the Highland community and what we plan to offer October of this year. So, generally speaking, A Wider Circle is dedicated to the mission of ending poverty. We do that through a myriad of different ways and a holistic approach. which means that we serve or help or address the whole issue, right? So we work on an individual level, a family level, a community level, and a policy level as well. We do that through a variety of programs, including our workforce development program, that offers things like professional clothing at our Silver Spring location and our professional development center, things like a boot camp, a week-long boot camp, which provides intense job readiness training, as well as other things such as one-on-one appointments that you can have at our Silver Spring location, our Shaw location, and our Southeast DC location. Highland specifically, we offer, we are partnered with DCHA, the DC Housing Authority, to serve the Highland additions and dwellings, public housing communities. What we do there primarily is what we call our market bag program. Through that program, we provide household supplies to families in need, and they're typically supplies that you can't get via SNAP. So things like laundry detergent, cleaning supplies, and things of that nature. That program is exclusive to residents of the Highland Additions and Dwellings community. However, we are in the process of expanding our services, and that's what we're going to talk about in a moment with our Families First DC initiative. But a little bit more in the Highland office. In response to the COVID-19 crisis, one of the things that we started doing, we partnered with World Central Kitchen in order to provide hot meals daily to residents of the Highland Dwellings and Additions community. And we also partnered with Lyft in order to provide free rides for groceries, as well as other various appointments that people were in need of during the crisis. Those programs will come to an end as things sort of return to normalcy. The meal distribution program is slated to end July 3rd, which is next Friday, I believe. And so what we're doing in the process is trying to get people ready for what that might look like, providing other resources, connecting people with other services in the community that are providing meals as well as groceries. For the market bag program, we had to stop because we weren't able to be in the community physically, so we couldn't physically distribute bags in the way that we used to. But that program is slated to restart this Monday on June 29th, and we'll be doing it via contactless delivery. So we're contacting residents in the community, letting them know when we'll be in the community. A team of volunteers and staff will come to your door, they'll drop the bag off, give you a knock to let you know that we're here, step back, allow you space to pick that up. So that's how that safe contactless delivery will happen in response to the COVID-19 crisis. Specifically to the FFDC initiative, the Families First DC initiative, at the end of last year, we were awarded a Families First DC grant from Child and Family Services Agency. This grant allows us to open what's called a Family Success Center in the Highland community. And what that is it's going to be essentially, we hope, a hub of services for families and individuals seeking assistance with a myriad of different issues in the Washington Highlands area specifically, but it'll also be available to any and all Ward 8 residents. And those services will look like a range of things. And specifically, we're trying to speak to community members to get a sense of what things they want to see brought into the Washington Highlands Family Success Center. So you may have received a call from me or from one of my colleagues already conducting community-wide surveys. We're going to continue to do those. We've conducted focus groups, and we're really just trying to get a sense of people's experience of existing services in the community and what services and programs they want to see brought into the community. So if you have not heard from me on that initiative and you want to lend your voice to that, I strongly encourage you to reach out. You've got the telephone number. For those of you who are not joining us via video, we have the telephone number to our Silver Spring office if you're interested in some of the services that we offer there, such as the furniture program, which is one of our flagship programs, also known as Essential Support Program. You also have the telephone number to our Highland office if you're interested in services specific to the Washington Highlands area or Ward 8 community there. And then you can also get in contact with me directly. Andrew or Dr. Tilley can provide you with my direct contact information if you'd like to speak with me specifically about the FFDC outreach initiative that we have there.
Great. Thank you, John. Appreciate it. And we all look forward to learning more and seeing more of the Family Success Center at Washington Highlands, and Sibley looks forward to continuing to partner with a wider circle in that capacity. I would now like to introduce Dr. Erica Richards. Dr. Richards is the Chair and Medical Director of the Department of Psychiatry and Behavioral Health at Sibley Memorial Hospital, as well as an assistant professor in the Department of Psychiatry and Behavioral Sciences at the Johns Hopkins University School of Medicine. She is board certified in psychiatry by the American Board of Psychiatry and Neurology. Dr. Richards is a member of the American Society of Clinical Psychopharmacology and the American Psychiatric Association. Welcome, Dr. Richards.
Thank you, Andrew, and thank you, Dr. Tilley, for the invitation. Lots of kind of background information about kind of the road that I took to get here, but the reason that I'm excited about being here to speak with you all today is because it's an opportunity to address mental health. And I think that while that conversation is starting to increase, while there are more people that are comfortable talking about depression and anxiety, I think that there's always more to learn. And I think that as a society, we still have to embrace the fact that we need to discuss these issues openly and honestly. And so what I want to talk about today is depression. But not only depression, I want to talk about isolation. I want to talk about grief. I want to talk about anxiety. I want to talk about this new normal during the coronavirus pandemic that we are all experiencing. And so what I want to talk about first is just how this transition occurred. And a lot of people have said to me, it seems like we woke up one day and then, everything changed. I wasn't going out of the house anymore. I wasn't able to grocery shop. And more importantly, I was scared. I was afraid for my family. I was afraid for my well-being, and I've had to navigate that a bit more. So what I want to talk about is how do we navigate? What do we do as we're moving forward? And what I want to say is that the short answer is we're all still figuring that out. I'm certainly happy that I can talk about what we know about psychiatry and behavioral health and what that means. And so part of this talk today will be related on providing information about depression and how do I know that I'm depressed, or more importantly, how do I know that I'm not depressed and I'm just adjusting to this new normal. And so I want to talk a little bit about that. We'll talk about factors that influence mental health, especially in minority communities, and how do we adjust, what do we say about that as well. And so what I want to talk about first, and I'll take that first slide. And if you're on the phone, then that's quite all right, because I want to make sure that everyone understands that the slides are supplemental, but we're going to talk about everything that is on the screen also. And the first thing I want to talk about are the factors that influence mental health. What affects our mental health? And while we're talking about that, then there's a lot of things that we need to play into this. We need to understand that our physical health is important. And sometimes people will come and say, well, when I exercise, and I know we'll get to what's available for us in terms of exercise and other things, but when I exercise, I feel better. What does that mean? Well, that means that there's something going on in our body. There are endorphins that are released. There are things that are happening when we move. And one of the criteria for depression becomes when we're not able to move like that. And what happens? So we know that physical health influences our mental health. We know that relationships influence our mental health. And the reason that that's important is because some of these relationships are not the same, right? Some people are stuck in the house with people that they're used to being able to get a break from. Now, be that kids, be that spouses, be that partners, whatever the case may be, we're not judging here, but we want you to understand that a lot of people are figuring out how to navigate relationships during this pandemic as well. Money, right? How are we doing in terms of our financial stability? Are we unsure because of all the people that have lost jobs during what's happening? And what does that mean about our ability to provide for our family? What does that mean for our ability to contribute to other households we may have been contributing to? And so our financial security is absolutely tied in with our mental health as well. Are we able to participate in meaningful activities is kind of that fourth factor that influences mental health. And the reason that that's important is because, again, we're starting to get used to this new normal. But a lot of people just said, well, I'm going to sit here for a second. I'm going to sit at home. I'm afraid to go. I'm afraid to move. Some people are outside not wearing masks. Others are, outside coughing. Some people are smoking. Does the smoke affect, if it affect me, if it gets to me? And so all these things. So what we found is that a lot of people sat stagnant for a minute. And while we do still promote the social distancing, while we do still promote the mask wearing, we have to understand also that we still have to get out and participate in some of these meaningful activities. And the last thing is discrimination. And I think that we'll touch on this a couple of times, but the way that these two pandemics have met right now with the racial injustices that are being addressed, as well as with our health crisis, I think there's a lot of reasons that people are feeling stressed right now. And so we have to understand these factors, because some people are saying, well, I'm so anxious, or I'm so irritable, or I'm yelling more. And what we have to understand is, yeah, but this is why. These 5 things that we just talked about, that's why. So we have to go in and systematically address, well, are there things that we can change? What can we do about this? And that's part of the resources that we're hearing about today as well. So I'll take that next slide. So the next thing that we wanted to talk about here is depression. And before I even enter the realm of depression, what I want to talk about first, and there's a term that we use in mental health that sometimes is called adjustment disorder. And disorder, a lot of times we think about, well, that's bad, that's wrong, and that's something that's wrong with me. But it actually is a term that we're using to try to make things more normal. We're supposed to have time to adjust to things. We're supposed to allow ourselves to figure out how we catch our balance again when we've been thrown off balance. And so the thought that, well, I'm sad, or I'm irritable, or I'm not eating much, or I'm sleeping all day, that doesn't necessarily mean there's depression. It might mean that, okay, you have to take in what's being asked of you and then come up with a plan. But taking a few days to do that, taking some time to say, whoo, I'm exhausted today, I need to sleep, that's okay. Even if you're someone who typically can go nonstop and knows exactly what you have to do for that day, things have changed. And so you have to allow yourself time to have that break. But I do want to talk about the criteria of depression, because I think this is another thing that's important to understand. And when we talk about depression, we're talking about whether or not there's changes in sleep. Now, sometimes that can be, I can't sleep. I'm up, I can't fall asleep. I'm up at 2 o'clock, and I've actually up at 3 o'clock, and I've seen every hour on this clock throughout the night. I mean, we've all had nights like that. That's the other thing you have to understand, is looking at this clock and saying, how am I up again? And sometimes there can be sleeping more often. And so changes in sleep are one of those criteria, but not the only criteria we use to determine depression. We're going to look at changes in interest in things. So sometimes we'll have people that say, usually I like exercising. Usually I like to get out. Usually I like putting puzzles together. I like playing chess. I like playing cards. And then all of a sudden I just don't feel like it. I don't want to do that anymore. So if there's a consistent change and you just have no desire to do the things that usually bring you joy, that's another thing that we want to talk about. Guilt, right? Lots of people have lost their jobs. Do you feel like it's your fault? Do you feel like you did something wrong about that? Do you feel bad because you don't feel like going out and playing, with the kids outside? And does that make you a bad parent? All of these things, guilt seems to kind of come up and really affect us when there is a depression there. But sometimes it's like, oh, right, I haven't played with the kids in 3 days and I should get out and play with them. So that's a different kind of guilt. We'll try it and see if that really makes you feel better. Loss of energy. Are you able to function? Are you able to get up? Are you able to move around? So looking at that energy level is really important. Are you able to concentrate? And a lot of times the example I use is a lot of people are reading now, reading more often. Do you have to reread that same page because you just can't follow what's happening? Do you have to, are you watching TV but really just staring at the screen and you can't really tell anyone what it was about at the end of it? So looking at those changes in concentration. Or if you're working, are you not meeting the deadlines that you usually are able to meet? Are you not able to really get through the emails that you're usually able to do? Those sorts of things. Changes in appetite, that can be increased appetite or loss of appetite. So you want to look carefully at both of those things, and not because you're trying to lose weight, not because now's the time you're doing keto or the other things that you want to do because you have an opportunity, but are you really starting to have these appetite changes and you can't explain why? Psychomotor changes is the next indicator, and that's a big term, but what we're really saying is, are you not getting out of bed? Are you minimally involved with talking to others? Are you just staring ahead all day? Those sorts of things. Or are you so restless that you can't sit still and you're just moving around a lot? So there's a lots of give and take and a lot of these criteria. And most importantly, are you having any thoughts about hurting yourself? Because, you know, some people will sometimes say, well, if you ask me about it, I'm going to think about it. But what we know is that more and more providers, more and more people that you're coming in contact with are asking because we really want to be able to help. And if you are having those thoughts, don't write them off. Let us help and let us talk about why that's happening as well. I'll take the next slide too, please. And so the last thing that I want to talk about also is specifically mental health in the Black community, because one of the things that's really important that we have to address is the fact that, you know, people of color are not immune. Now, there are many, many, many historical documents that will say why we are either not willing, not able, afraid to discuss our own mental health. But what we know is that this data is a couple of years old now, but about 16% of the population, of the US population, has a diagnosable mental health illness, and that's of the African-American US population. And so those are not the numbers that we're seeing asking for help. And so we only say that to say there's a reason that we're having these discussions. There's a reason that we're bringing it up. Sometimes we say, listen, it's okay. This will get better. Let's talk about why you're having this anxiety. Other times we say, okay, I'm worried. I'm worried about the fact that you're not sleeping. I'm worried about the fact that you haven't been able to take interest in things again. And we need to talk about other medications. Not everybody that has depression has to go on medication. Not everybody with anxiety has to go on medication, but it warrants a discussion, because sometimes there's just ways that people can help you navigate what's happening and why there's that increase and that spike. So I think the bottom line is, during the era of the coronavirus pandemic, allow yourself the time to adjust. But if you are struggling, know that there are resources out here that can help with that. I think that's my last slide. And so I can stop there, and we might have questions with Dr. Tilley at the end, it sounds like.
Thank you, Dr. Richards. Dr. Tilley, do you have any questions?
Yes, I do. I had to get off mute to do it though, right? Yes, thank you so much, Dr. Richards. Yes, and we do have a few questions if you have.
Absolutely.
Okay, great. So have there been any changes, would you say, in the number of people reaching out for psychiatric support since the start of the coronavirus epidemic?
So it's a very interesting question, because what we saw, it's quite interesting. What we saw when the pandemic first started and when there was the mandated shutdown, our numbers went down significantly. So I'm at Sibley Hospital. We have an emergency room where we see people that are urgently in need of psychiatric care. We have an inpatient unit where we can admit those people if they do need additional care other than an evaluation in the emergency room. But what we found is that those numbers even drastically went down. And I think for a time being, we had families that were able to wrap their arms around people that were suffering from severe mental illness. We had people that, even if they were ill, still weren't willing to come out and get the help. So initially, we saw fewer numbers, especially for urgent needs. But over time, what we're seeing is both the urgent need for interventions in the emergency room, as well as additional outpatient needs, meaning people reaching out and saying, I need a new provider. Can you help me locate a new provider? I want to talk to either a therapist or a psychiatrist. We're seeing a significant increase in those types of requests. The other thing that's interesting is a lot of times now we've moved, when possible, and I don't know how long this will last, but when possible, we've been able to move to either to a telehealth model. Now that's either with video or on the phone. And what we found is that people are actually more open to coming to those appointments. They're missing those appointments less, maybe because they don't have to travel, maybe because they don't have to get up, maybe because they don't have to drag themselves out of bed, but we are seeing higher numbers overall for mental health requests since the pandemic started.
Wow, that is so interesting. This pandemic has opened up possibilities in a lot of different ways and opportunities. So maybe we're on to something with that. You know, I hope so with the telemedicine. So another question, do you see any common issues that people, particularly the minority community, has seen to be dealing with during this time?
So another very interesting question, and I can say that what I'm noticing is a lot of times the anxiety that we're seeing in the Black population in particular is often combined. So they are coming in and people are saying, I'm scared, I'm nervous, I'm isolated because of the coronavirus. But then they're saying, and I'm afraid because of what's happening on with racial injustice in this area. So I recently have seen people that say, I'm caring for this loved one who really needs help, either because they are manic or they're so depressed, I couldn't get them the help that they needed. And a lot of times in different settings, and we certainly won't have time to visit other issues when there's abuse in the home or those sorts of things. But in general, people are now afraid to reach out sometimes for help when they do need other interventions, often by calling 911 or those sorts of things. So what we're seeing is that sometimes people are getting worse, people are sicker by the time they do come and get the help when they're able to come in, or when it's used as a last resort. So I think that people are really trying to navigate what do these two pandemics mean for me, and where do I fit into this? And there's things, and I'm going to mention things like this because I think it's important, but there are instances where, because of anxiety, I've seen people say that any kind of bang, they're really jumping at now because they are interpreting it as, maybe it's a firework, but they're interpreting it as a gunshot or these sorts of things. So it's just a very tenuous time where we have so many reasons to feel anxious.
Wow. Yeah, so Dr. Richards, I have been hearing about many communities, many cities now looking at deploying social workers and behavioral professionals in cases where there seems to be a mental or emotional kind of disruption. So what are your thoughts on that?
I think that this is one of the examples they used. They've used for a lot of the recent things that have happened, right? Especially when nonviolent crimes are occurring. I think that there is a need for additional training for de-escalation, and I think that we all are able to get better at what we do with time and with training. And I think that training, it needs to involve a lot of compassion and whether or not these issues can be resolved before they become violent. And so I am absolutely, I work very closely with social workers here at the hospital. And a lot of times I think that compassion that they're able to show goes a long way with still getting really good outcomes to help others.
Absolutely. Okay, one more question.
Okay.
What do people do? What should they do if they feel like they need additional support or treatment for behavioral health issues?
Yeah, so I'll be clear that psychiatry, while I love my field, it is often hard to find a psychiatrist. And I think anyone out there that still has training available to go into the areas that we've talked about, social work, mental health, any of those things, there is a need. And the one thing that I didn't mention that I need to bring up also is substances, right? So that's the other thing that we're seeing is an increase in substance use. Now, part of that can be more drinking, more alcohol than usual. The other part of it is I don't actually have to go to the office the next day, so I guess I can try this thing because I can sleep in if I need to. But we are still seeing increases in people that have to come in for urgent care because they decided it's worth trying this new thing. So please be careful, both in the volumes of what you're using and in your risk taking at this time, because those are reasons when you're home trying to avoid coronavirus but have to come into the emergency room. We certainly are using every precaution, but you could end up here, you know, where there are higher risks. So I just want to kind of to say that, but in addition to that, I think that the easiest thing to do is to reach out to a provider that you trust. Reach out to somebody that you trust. And that can be many different forms. It can be someone at the church. It can be your primary care provider. For women, a lot of times, it's possibly your OBGYN. It can be a social worker that's nearby or local that comes around. But just reaching out to someone that can point you in the right direction is the first step. A lot of times, if this is anxiety or depression, primary care doctors can really get you started if there is a need for medication. And if there's something else that they see, then they can help you navigate how to find a psychiatrist during this time. So those are the bigger things. If you're worried about safety, if you're having thoughts about hurting yourself, any emergency room, we might not have to admit you, but we can at least make sure that you're safe, because sometimes that desperation is a wave and it will get better. And so we do want you to reach out for that help. Also, there is a suicide hotline as well, and you can always call that. And if they need to send someone out to help, that's another avenue. There are crisis interventionists that can also come to you or your loved one, which is a different avenue than calling 911, but they are behavioral health trained professionals that can sort things out to determine if there's a higher level of care that's needed.
Wow, great. Wonderful, great information. Thank you so much, Dr. Richards.
Oh, thank you for having me.
Thank you, Dr. Richards, for being here and for sharing that important information. Next up, I would like to introduce Mr. Delano Hunter. Delano is the director of the DC Department of Parks and Recreation. He comes to DPR from Serve DC, which is another district agency where he was the chief service officer for the district. Mr. Hunter is a native Washingtonian, attended Delaware State University, where he graduated with a degree in business management, later going on to earn his MBA from the Johns Hopkins University Carey School of Business. So we're moving now from the mind into the body, and welcome, Delano. Thanks for being with us.
Thank you. Thank you so much, and good afternoon to everyone. First, I'd like to thank Dr. Tilley and you, Mr. Huff, for the invitation. Also, I'd like to commend Mr. Kemp and the Wider Circle. I'm a big fan of the Wider Circle and the work that they do. And Dr. Richards, thank you for that presentation. It was really informative. Good afternoon, everyone. From the Highlands community, again, my name is Delano, and I am proud to serve as the director of the DC Department of Parks and Recreation. And I wanted to talk a bit about some of the services and activities and offerings that we anticipate this summer. As a native Washingtonian, I certainly recognize the importance of the institutions that are here to serve our community, and recreation being one. It adds to that sense of well-being, that sense of connectivity, a positive outlet. Dr. Richards talked about exercise, and she talked about that engagement and that feeling of belonging, and it's something that we're proud to facilitate at DPR. And it's been challenging for us. You know, summer is our prime time. It's an opportunity. When you think of summer in the district, you think of pools, you think of summer camp. And those are the things that we are chomping at the bit to do. But of course, it's difficult during this COVID climate. But slowly but surely, as we address COVID-19 and we enter into this phase reopening, there are services and programs that we're proud to offer, and I want to share some with you specific to the Highlands community. And before I get into my slides, I'll say this. In addition, specific to this community, many of you all are familiar with the Fairview Hope Recreation Center. You know, this summer we have a plan reconstruction of that entire site that'll yield a new recreation center, but also a new school by Kemp Public Charter School. So there was some planned service gaps this summer that I'd be happy to speak to throughout in my presentation about other services that are nearby. Next slide. So I have two offerings that I'd like to share with the community in the hopes that folks will take advantage of. The first is Camp at Home. Camp at Home is a blend of self-directed and parent-led activities. There's an activity guide and also a fun pack, and we anticipate distributing about 5,000 or so. When we initially planned this in late March and early April, we were of the impression that in-person camps were totally off the table. And I'll talk about those in-person camps, which we anticipate we can offer now. But we went ahead and developed this great, what I believe will be a successful platform for Camp at Home. So it's really designed to, I know that a lot of parents and kids are telling us, after coming off of a few months of distance learning, the thought of more at-home activities is something that can be a bit daunting. But however, we think that with this blend of activities and the fun pack and then the programming that we'll have on the district's DCN, affectionately known as Channel 16, and the District Knowledge Network, that this is the next best thing to in-person activities. So we plan to serve about 5,000 kids. And what's interesting about this, we had enough just for those kids that are registered and were on our wait list. So we've served that population, and there are some remaining. And I pulled in a zip code address with this community, and there are quite a few folks that have taken advantage of this. However, but there is some availability remaining. If you subscribe to any of our information, you'll get an email about that. Also, I would ask you to go to dpr.dc.gov beginning tomorrow, and there is the opportunity to pick up this free pack. And I like to say that fun pack probably has about $150 value with everything you need, from athletic activities to games, to other arts and crafts supplies, to science exploration, STEM activities, and is geared towards ages 3 through 13. So definitely, if you're interested, please take advantage of Camp at Home. And again, log on to dpr.dc.gov. Now, moving to the right side of the slide, you'll see Fun and Sun Camp. This is something that is rapidly evolving. We anticipate serving about 3,200 kids this summer in an in-person and socially distant camp. We're going to be spread across 27 locations across the district, and these will be 3 two-week camp sessions. Again, I know that camp for many of us, it was a rites of passage no matter where we grew up. So it's important that we what we like to call level the playing field. And we know that some of the private and for-profit camps, so if we're not for-profit, they do a great service. I don't say for-profit to diminish, but again, those private camps are moving forward. So we think it is of critical importance that we have this opportunity for our residents, because we have some of the lowest cost, probably we like to say in the world in terms of our camp offerings, and we know how important camp is. So this will have a large focus on outdoor activities. There will be some limited aquatics. We'll have those traditional activities, and what we're really preparing for to serve our residents across these 27 locations. So this is likely to start in July, the third week of July, and we'll go through August. So we'll bump up against the start of the school year, and you'll hear more information. So we're still fine-tuning what registration will look like. But again, we are going to offer this to individuals. And again, there are many in the Highlands community that had already signed up for camps. So our first priority is to try to serve those that were already registered for camps or waitlisted. And then with the balance of those, there will be a process that is to be determined by the mayor in terms of how we will handle registration for those. I also would like to say, just adjacent to the Highlands community, many of you all are familiar with the Southeast Tennis and Learning Center. They are a partner that is a DPR facility, and they are a partner. They will also offer a camp as well that'll likely start a bit earlier, and they'll serve that cohort of kids that they normally serve throughout the school year. And again, a number of those kids are from the Highlands community. So I'd like for you to keep an eye on communication from SETLC. Next slide. Now, in the event that you are not interested or you've already have your summer offerings squared away, there are several other offerings that we're proud of that we hope to be a part of your summer activities in phase 2. The first would be outdoor pool access. Again, another rites of passage here in the district. Closest to this community would be the Oxen Run Pool. We anticipate opening that pool in mid-July for approximately 57 hours a week. But, you know, there are going to be some important distinctions this year. Typically, when you think of pools, you think of leisure recreation. For this one, we'll open up availability for lap swimming, typically one person per lane, and that will be a free offering that you'll have to register for. So we call it lap swimming. The next one, we're going to offer swim classes. So learn to swim classes, primarily for children, but also adults of all ages. I'll admit, I have to take swim lessons this summer. So, you know, we're offering swim classes and also water aerobics for some of our seasoned swimmers and some of our seniors. It's a really popular program. These will require a registration. Again, there's very stringent requirements from DC Health in terms of the number we can have in this facility at any given time. And also there'll be stringent standards for the cleaning and the frequent cleaning of the pool houses or locker rooms, as we like to call it. And again, if your kid is registered in that Fun and Sun camp, they will also have access as well. On the right side, there are a few other key offerings as well. You'll notice that we're officially reopening many of our playgrounds and basketball courts, our tennis courts, our dog parks. We are opening those with recommendations from DC Health, which will be reflected on signage. As you participate in your or utilize your facilities, we just ask that you try your best to maintain an appropriate distance, certainly to use hand sanitizers, to wear masks when appropriate, when social distancing is not possible. So additionally, we'll issue permits. We know we're approaching the Independence Day holiday, so cookouts, birthday parties, the likes that are known in summer. We will issue permits for up to 50 people. And that process and that permits window will open fairly soon. I'll also just highlight other remaining activities. I'll highlight the grab and go meal service. And we're serving about 120 meals a day at the Fairview Hope Recreation Center. So that is available to you, to youth in that community. And then also nearby at I believe the Eagle Academy on Mississippi and Valley, and also Simon Elementary, those district, that DCPS school and that charter school, they also will offer grab and go meal service as well. You will receive lunch and then breakfast for the next day. So I know that was a lot just in a few slides, but these are just a few of our offerings. And I'll just reiterate that we recognize the importance of summer and the programming that we offer. And I just want to let the community know that we're chomping at the bit and we're really anxious to get back to serving our residents. Thank you, Dr. Tilley.
Yes, thank you. You have time for a few questions?
I do, absolutely.
Okay, great. You did give the website for the camp at home and Fun and Sun camp. Can you give us that again and tell us the ages?
Yes, so it's dpr.dc.gov. So both of those, and again, a lot of this is just really, I mentioned to Andrew that a lot of this stuff was in rapid development. So if you don't see anything today, you'll certainly see it tomorrow. We just got to go ahead to offer that up, to open up Camp at Home. And we typically, we serve ages 3 through 13. So that's that's the typical demographic, age demographic that we serve for camps. So this will be available to children of that age.
Okay, all right. And another question, you said that there are about 120 grab and go meals that are going to be at Fairview Hope. Do the kids have to register for that too?
You don't. And we have the capacity to serve well beyond that 120. So I was excited when I issued this invitation from Andrew, because this is one program in particular that I wanted to promote. The only criteria, you do not need to pre-register. You can come between the hours of 10 a.m. and 2 p.m. And it's important that you don't come a minute early or a minute late. So that is available for kids 18 years of age and younger. No registration is required.
Okay, 18 and younger.
Mm-hmm. I will note for members of the community, next Friday, July 3rd, will officially be the Independence Day holiday. So it'll be recognized for government. So we won't serve that day. But typically, you know, once we get past Independence Day, it'll be Monday through Friday for the balance of the summer.
Okay. Wow, this is great. I mean, it just looked like last week that it was not going to be as fun of a summer. But you all have added so many other activities, and I'm really happy to hear this and happy to share it with the residents of not only the Highland community, but other communities around the city. And I'm sure parents will be happy to have their kids go out and play a little bit.
That's right. That's right. And Dr. Tilley, you know, I have a 4-year-old and a 3-year-old, and so I know the challenge here.
Absolutely. Well, thank you so much. I appreciate it. Those are the questions that one other question. No, I do have one other. When, and you may not know the answer, but when will the traditional outdoor pools access resume?
Thank you. Yeah, I will say this is going to be an adjustment. We are all accustomed just to, you know, it's hot today, I want to go to this pool. It won't look like that this summer in phase 2. We hope to resume normal offerings likely in phase 3 or phase 4, so later in the summer. So I did want to add that, you know, it won't be what we're accustomed to. It's very structured and we have to limit the number of people at any given time. But if we can get to phases 3, maybe phase 4, we think at that point we'll be able to resume our traditional pool service.
Yeah. Well, may I ask then that, you know, for the sake of the parents and the kids, maybe you can set up a hotline or just be timely in terms of changing things on the website so folks know what to expect and when. That would be really helpful for all.
I think that's a great suggestion. I do. Again, we were talking about this just prior to this call, and we mentioned, you know, we got to go beyond just social media or posting something on the website, or even depending on email marketing. So we know that some of those traditional means, like that hotline, may be one that has a lower barrier of entry to get information. So that's well noted, and we're going to move on that. Okay,
great. Thank you so much.
Thank you.
Thank you, Delano, and I apologize for mispronouncing your name during your introduction.
Tomato, tomato, Delano, it's all good.
That's great information, and we look forward to hopefully continuing to move through the phases of Reopen DC and to a point where all of the great offerings from DPR are available to us again. Dr. Tilley, we have a neighbor on the line, I think, from Washington Highlands, Mrs. Tutt. I'm going to...
You gotta watch it. He might have to take it with her. I can't do it. I told my little brother yesterday. I said, I can't do it. I don't know. I can handle her if she's metal and stuff. I have
right now.
Sounds like Mrs. Tutt has something going on.
Yeah. She was in the middle of, she has a group. She is so incredibly active in the community. And she has a group of girls that she works with as models. And so they have a meeting today. And what she was doing was taking time away to greet and say hello to the Highland Additions and Dwellings residents. So, you know, she's probably gotten back in the throes of the modeling meeting. Are you there, Ms. Tutt, or?
Yeah, yes, I'm here.
Okay.
I'm here.
Okay. So.
How y'all doing? I'd like to say hello to the Highland Dwelling and Highland Addition community. We doing a lot over here. I am over here with the models, but I am online listening to everything.
Excellent, excellent. This woman is busy all the time, and she is such, you know, she's just such a benefit and asset to the community. And I really appreciate her and her efforts and everybody's efforts during this time, not just during this time, but especially during this time. So thank you so much for joining us, Ms. Tutton, just taking a few seconds out of your busy modeling schedule there.
Thank you. You're welcome.
Thank you.
Thank you. Thank you, Mrs. Tutt. We work with a great group of residents at Washington Highland, and I'll let Dr. Tilley talk a little bit more of that as we wrap up. But before that, I just want to say thank you on behalf of Sibley Memorial Hospital, a member of Johns Hopkins Health. Thank you to A Wider Circle, to the DC Department of Parks and Recreation, and to Sibley, Dr. Richards at Sibley, for providing this information today. And thank you to those who have tuned in. This webinar is being recorded, and so we'll be able to view it after the fact when it's posted on the Sibley website. Dr. Tilley, would you like to say a few words as well?
Yes, I would. I do. I have a couple of announcements. One of the things, as the Highlands community, both dwellings and additions, have resident council meetings every month, and haven't been able to do that. And so I wanted to use this as a vehicle for announcements from different entities who serve the community. And so one of these announcements is coming from DC Housing Authority, and it was given to me by Marcus Manning, and it's about a scholarship program. It's called Commitment to Excellence. And the Commitment to Excellence Scholarship Program provides financial assistance in the form of scholarships to public housing residents and Housing Choice Voucher Program participants enrolled as a full-time student in college or an accredited training program beyond high school. And so applicants can obtain a scholarship application at the DCHA's website, which is dchousing.org/scholarship. But the thing is, the deadline is June the 30th, which is next week. So there is a phone number. It's 202-535-2889 if you want more information about this scholarship. I don't know the amounts or how the decisions are going to be made, but if you have someone in your family who's in high school or college and could use a few extra dollars or so, then I would just encourage all of you to make this call or check out the website. Okay. And this other part, the other thing is our program that we do with the Highland community. It's called the Sibley Health Warriors Program. And it's our intention this fall to start the program up again. And it'll be the second one we do with a group of residents. And once again, I was saying it was on self-care, chronic disease management, and we have a fun and active kind of environment when we do it. We play games, we learn with these games, and we serve really good food too. So please call and leave a message if you have any questions. Leave a message or a text at this number. If you have questions about that program or anything you've heard here today and you need more information, the phone number is 202-265-6100. That's 202-265-6100. And we'll also, if you leave your information in a text or something, you'll get notified as to when we have our opening dinner to talk about the program and share it with you and give you the date so that you'll be able to sign up. So hope to hear that phone ringing. Now what I want to say is that we are going to do this next month and in August, a webinar. Hopefully soon after that, we'll be able to meet in person. But if this works for folks, and I'd like to hear your feedback too. You can use that phone number to give us feedback about what you think about this, this particular platform in terms of sharing information. But our next webinar will be July the 23rd at 3 o'clock. That's Thursday, July 23rd at 3 o'clock. And we'll be sending out notices, texts, flyers, different things like that. So, okay. Well, thank you for your participation. Thank you for joining in. Let us hear any questions, comments that you might have. And I appreciate having Dr. Richards and Mr. Hunter and Mr. Kemp. And always a pleasure working with you, Mr. Huff.
Thank you, Dr. Tilley. And thank you again to our panelists for joining us today. And thank you to the residents that joined us for today's Sibley webinar. caring for mind and body during COVID-19. Take care of yourself, and we hope to see you next time.
Stay safe.
Thank you, everyone. Take care.